After we have explained the blockage material and why we used it and how to do it, and we explained the features of wire bending, now we're ready to perform wire bending actually on the casts. So after you have now finished the blockage of undercuts, now we are ready to bend our clasp into place, because this clasp later on will be part of our removable partial denture. So how do we bend it? You have finished the blockage material. Here you have put the blockage material in orange so you could see it under contrast. The blockage material are on the teeth that we might do clasps on. So we begin by taking a wire. The wire we're using is a 0.7 wire, as we have told you in the criteria. The amount of material that we cut is just around 7 centimeters, not more. This is sufficient for a clasp. So we use our cutter in the protective way we talked about. We protect both ends that we're going to cut to make sure that they don't fly away while we're working. So I'm going to cut off the wire. And then we're going to do the straightening step. That's important for us because we will need to work with a wire that is straight. This will help us that the wire will not keep flipping in between our hands. It will stay straight and I could orient it accordingly. So I'm going just to bend it opposite to the curve that it has. It has a curve because the container that it comes from, it is rounded, so it comes in loops. So it has some inherent bend in it. So we just want to straighten it, especially the first part of it. And the last part, it's okay because we're going to not use it. So the first part is now straight with us. Now we're going to do a loop. Now, the first part is a curved C shape or like half a loop, and this is going to adapt to the tooth. It depends on the size of the tooth. For example, the mesial distal width of the canine is smaller than the mesial distal width of the molar. So that means the C shape of the clasp that we're going to produce here is more narrow than this one. So we're going to make the loop according to the tooth size. So we're going to begin by using the first motion, which is making a curve. We make a curve by bending against the circular part of this player. So the player has a rectangular part and it has a circular or conical part. So this beak is the one we're going to use. So I begin doing the movement for producing a curve. So what is the movement? It's small pressures, multiple points where I'm pressing, and this now produces this curve. Okay, but this curve is shallow, very shallow. It's not enough to wrap this tooth. It's very shallow. It will be wide and it will be loose. If I'm going to adapt it on this tooth, it will be very loose. So I'm going to tighten it or even narrow it. So how do I do that? I don't go by bending points. I go from the beginning and I put in new bends in the same surface. So I'm going to bend even more. And then after I finished this C shape that is produced by this work, I'm going to compare it with the tooth and see if it's sufficient or not. If it was the molar, most probably this is sufficient. Okay, it adapts around the tooth very well. It is not loose. But if I'm going to put it around this canine, I find still it's loose, so I'll need to put more curvature in it. So if I come closer here, it's loose because it is wide. This is more wide than the curvature of the canine itself, so I have to retighten it. So if I take a close look at this wire, so it's adapted around the molar, it goes into the embrasure, and up to this point, this wire is correct. So this is the point I'm going to begin bending inwards by. So I marked the point and I'm ready to bend the next bend. So I take the wire, I maintain this C shape, I orient it by the same orientation it's on the tooth, and then I hold it inside the players. So I put the C shape inside the player. It's in the same orientation it was on the tooth. I'm keeping the same orientation. What I need to do, I want to make this wire closer to the tooth and downwards. So I'm going to do the same movement that produces this. So what I'm going to do, I'm going to take the wire and bend it like this, inwards and downwards. I hold the wire firmly. The mark is outside the peaks. You can see that the mark is outside the peaks, and then I press downwards and inwards. Sometimes it goes out. If it goes out, that means that my grip on the C shape is not perfect. So I have to have very good grip on the C shape before I begin bending this wire. So I make sure that my grip, my side grip on the handles here is very tight around here. And then I begin doing this downward movement. And as well, I'm going to do an inward movement. The inward movement will come, the wire is going in this direction in the beginning, so I'm coming closer to the tooth. So it's downwards, inwards, and I check my new location. So I put the wire on the tooth and I begin looking at the tooth. I find that it's too much far away from the tooth. I have to come closer to this direction. But the downwards movement is also very close. So I need to bend it downwards. But the problem here, if I do bend it downwards at this time, it will be hitting the other side of the clasp. This is why we need short clasps. So now I could bend in the tag and cut it before I continue the final adaptation. So what I'm going to do, I'm going to put it like this. I'm going to estimate the length and measure where is my tag. The tag should go close to the midline. So this is the midline. The tag should run up to here, close to the midline. So I estimate the length and do a tag. So my tag is a sharp angle downwards. And we said we need this tag to have acrylic embedding inside it. So this is the estimated length I want. I'm going to bend it sharply towards the pallet. I make sure that I'm still having the wire in the same direction of the tooth. I bend it sharply to the pallet, and then I bring the plier. I don't use the plier in the deep area. I use the plier in the shallow area. And I put it adapted. I leave around 2 to 3 millimeters. 2 millimeters are sufficient. And then I begin cutting. And then I put the clasp back. I adapt it to the buccal surface. And I begin watching its location on the palatal. So my notice is that after adapting the buccal very well, this proximal part is away from the tooth, but this tag is going in this direction. I don't want it this much. I could go further inwards. I'm going to put the C shape inside the pliers, okay? And I'm going to then tighten this grip and hold this tag and push it in this direction, okay, against the clasp like this. And then I'm bending the wire inwards. I make sure that my grip is firm, because if it's not firm, the wire would keep rotating in between, okay? Firm grip, and I begin bending inwards, and I put it back and check it on the molar. This is the buccal adaptation around, okay? So I'm going to repeat this procedure, doing it for the canine, and to show you how to do narrow curves. So if I'm going to take a wire, once more it's a short wire, I don't need that much. It's a short wire, around 6 centimeters. I straighten the first part of it. Once it's straight, I'm going to do a curve. So I begin curving using the loop part. And what do? I try to produce multiple curves. So how do I do that? I put the plier at the end of the wire, and I begin bending slowly. Multiple points of bending. I produce a C shape. I look at the C shape and compare it with the canine, put it around the canine, and I find it's still loose, it's wide, so I'm going to narrow it. How do I narrow it? By bending once more at these multiple points. So I'm going to rebend, going back at the tip, and bending. Okay, we have bent it more. I adapt it to the canine area. And once it's fine, I'm going to now put the point where the C shape ends. I'm going to put it, this pointer. I put the C shape inside the pliers. I bend downwards and inwards. So firmly hold it downwards. So I begin comparing the C shape once more with my canine. If I find that the curve is steep, I just can reopen it a bit. After I finished, I am going to adapt it to the canine, so I found that buccally it's okay. Palatally, now it's very close to the tooth. I need to open it a bit away from the tooth, and then I need to go and end the tag. So before I finish, I'm going to estimate the length of it. So as we said, we are going to come close to the midline, but not over it. So this is around the point that I'm going to cut. So before it, by 2 to 3 millimeters, I'm going to produce my tag. So this is the point. I orient it. I put the point I begin bending towards the pellet in a sharp bend, and this sharp bend, after it's 90 degrees, I'm going to cut it with the shallow part of the plier, and then readapt it towards the pellet. This is the length of it. As you can see, buccally it's adapted, but it's close to the tooth still, and still the tag is away from the tissue. So what I'm going to do, I'm going to bend it once more. I'm going to produce the C shape. I'm going to take it away from the tooth a bit. I'm going to reopen it a bit, and then bend it downwards towards the pellet. This downward bend will produce the palatal adaptation. So now I'm finished. I'm going to adapt it to the canine. I'm going to put it on the canine and check. Okay, I find that the buccal adaptation is there. The tooth orientation is okay. I'm still close to the tooth and closer to the palate. I'm just going to reopen it here to go away from the tooth. But the palatal adaptation is fine. I have a touch here. I'm going to avoid this touch. So I'm going to bend it, open it a bit. I'm going to open it and push it away from the palate a bit. And this, let's see what happened with the bending and see the final location. Okay. So now you can notice that on the palatal side of the tooth, it's no longer adapted to the tooth. There's some space between the tooth, there's some space between it and the palate, and it ends with that final tag. So this is how I wire bend. The only difference with the lower is the location. If I'm going to adapt this to the lower, the location of the end of the tag is related to the floor of the mouth. So if this was the floor of the mouth here, the tag should end 3 to 4 millimeters above it. So I'm going to adapt the same tooth, the same clasp to this tooth, and show you the difference in between them. So if I'm going to place this and say this was done for this tooth, for example, okay, and I noticed from the tag area, this is where most of the problems that students have, that the tag area is long and it's touching the floor of the mouth. If I have this situation, if the clasp is okay from all directions and we have space between it and the tooth and goes down towards lingual, okay, but it's long, I simply just rebend, do another bend at this end, and then cut it once more. So I'm going to bend it once more. I'm going to bend it once more in 90 degrees, but shorter than the first one, and then I'm going to cut it. And this is the clasp adapted to the lower. So the only difference between the upper and the lower in terms of adaptation is that the lingual is more steep towards the lingual, and we have the problem that the floor of the mouth is closer. So that means that the tag should be shorter. So this is the tag at its final position. Okay, at its final position if we were going to adapt it to the lower. So we have space between it and the tooth, and we have space downwards. So what is the benefit of the space? We just revise it that the wire, when it comes around the tooth, just to revise what we said, that when we have the blockage material in place, we make the wire away from the blockage material. We have such space between it and the blockage material. Once we make our removable partial denture, a part of the acryl will run down beneath the wire, and this will produce a space. The acrylic will be touching the tooth on the survey line. The wire will have some space. So by squeezing the acryl, it will go beneath this clasp. So we will have a layer of acryl beneath it, and we will have a layer of acrylic above it. So the wire is totally embedded between these two layers, and this layer of acrylic that goes proximal and goes towards the tooth, this embedding acrylic, it's not too thick to prevent a next tooth to come in, and it's not too thin that if we trim we might ruin the wire. So as you see that the wire is embedded between these layers. So that's also another reason why we don't make this far away from the palate, that we want a very shallow amount of material, or we want a low thickness of the acrylic to go beneath it. So the acrylic is embedding. So if we look at this partial denture from the inside, if this was our partial denture and we look at it from the inside like this, from this side, we don't see the wire touching anything on the palatal surface except the tag area, where it comes and stops the acrylic from pressing the wire. So the only point of contact of the wire on the palatal side is on the tag area. So I have a good amount of acrylic beneath it, and we also have a good amount of acrylic above it. So that means the wire is totally inside acrylic. We don't see any part of the wire. So if I'm talking about this wire, notice that I could not see any of the wire from the palatal surface except the tag area. So the wire is not showing through, even proximal, it's not showing through, it's embedded in acrylic. And on the other side, we can see it. We don't see it from the polished side. So the wire is totally embedded in acrylic from the fitting surface and from the outer surface. So we don't see the wires, okay, showing through the acrylic. So thank you, and you may begin wire bending the upper and the lower. For the upper, you will need 3 clasps. You're going to submit 3 clasps over the abutment teeth, and for the lower, you're going to also submit 3 clasps for them. But we will evaluate only 2 of them. So we will choose the best 2 for evaluation. But for the training purposes inside the lab today, we will need you to make all 3 of them. Fix them using utility wax, just a small amount of utility wax. If you can make it even smaller than this one, it's okay, because we will take the wax away when we are going to mark your clasps. Thank you very much.